pharmacology students. My name is Cortney Muldoon, and I chose to do my presentation on Lunesta. I chose Lunesta because it always seemed that when I've seen on commercials, it's just easy to remember that little butterfly that comes through the window and lands on everyone's shoulder. Just seems like a nice, peaceful commercial that probably many besides me are very interested in. So I chose Lunesta from the commercial to research more pharmacology on. It always seems that it stands out to me, probably just as corny as I am, but a butterfly that comes in and magically everyone falls asleep. If only it was that easy. The commercial explains that taking Lunesta daily before bed can help an individual get 8 hours of sleep. The quote states that, "Wake up often in the night, Lunesta will help you fall asleep and stay asleep for 8 hours. In the small captions, though, at the bottom of the screen, it explains the meat and potatoes of the drug, in my opinion, and is nothing that the commercial talks about. You have to have good eyesight to read it and to figure out what the small caption is saying before the commercial ends. By pausing the commercial a few times, I read in the small captions that the results may vary. Clinical trials have helped the majority of patients sleep up to 8 hours. Well, when they explain the commercial, it states that most individuals get 8 hours of sleep, but in the small print, clinical trials only had 7, so that's a false advertisement right there. There's a risk for dependency with prescription, and it is a non-narcotic, which does state in the small captions, but someone would have to really have good eyesight to see that. It does talk about some side effects. There's unpleasant taste, headache, dizziness, and morning drowsiness. But you have to kind of squint to see that at the very end. It's nothing that they state in the commercial. Comparing these two, the product insert with the commercial, there definitely was some differences. I found that they were very similar in explaining everything, but on the commercial you had to really look at the fine print, whereas the insert just lays it all out for you. The commercial talks really fast. And at the end, it's all fine print. Where the insert kind of goes into more detail. It has a little bit, the commercial's only a minute long, where the insert kind of goes over all of the side effects. The insert talks more about behavior changes that might occur, like aggression and hallucinations, sleepwalking, and confusion. The insert states that using it for long-term use, you can have addictive symptoms and is not recommended for longer than 6 months, which on the commercial it seems like someone could take it for years on end and be fine. Also in the insert it states that there's no guarantee for sleep. The study only said 7 hours at best for sleep in the insert, but yet on the commercial they really push for, that Lunesta will help you sleep 8 hours, which is definitely, false comparing to the evidence-based clinical trials that they've done. So that's kind of a false advertisement. Right off the bat, that's something different that, should be looked at a little bit further. I know that they're selling their product trying to make money, but in the grand scheme of things, you want to sell a product that, doesn't have any false words in it, and that definitely right off the bat says that they're kind of trying to make money on this drug. How would I approach this med if a patient of mine came to the office and said they wanted to take it? I'd first, not want them just to go by a commercial. Like anything else, commercials are always trying to sell a product. So, pharmaceuticals are trying to sell Lunesta to, individuals, and, by showing them this butterfly that comes and lands on their shoulder and all of a sudden they fall asleep, they might need some more information about that before they actually take it. I want to see him or her in the office to come in and just kind of talk about what their thoughts were about the medication and what they're trying to get out of it. Let's see. I'd want them to make an educated decision. The best education's power, so especially when it comes to pharmaceuticals, individuals need to know the pros and cons of each medication before they really decide that that's something they want to do. Let's see. I would definitely tell them, those side effects that were in the pamphlet that they don't see on TV. Behavior changes are very possible. Daytime sleepiness, and before they take the medication, they really need to know that this, could cause them to be really sleepy during the day or have aggressive behavior. because those are definitely some side effects that the commercial with the butterflies obviously doesn't portray. I'd want to caution the patient if they had any respiratory disease or hepatic impairment, just due to where the medication is processed. And if they were an elderly patient, I would not recommend this medication for sleep due to increased risk of confusion and agitation. Older individuals don't process these medications as quickly, and it's definitely not something that they should be taking. So I definitely caution the elderly if they came and wanted a medication like this. My personal position on pharmaceutical advertisements. Personally, I'm not a fan of pharmaceutical advertisements. I believe they give everyone a false hope, especially that quick fixes. I find pharmaceuticals are always just a quick fix, and I feel like as practitioners that you kind of need to get at the bottom of why individuals feel like they need these medications. Lunesta sells it with this butterfly, and who doesn't like butterflies? So just realizing that what they're selling is all these happy individuals that don't look sick at all, and in real life, people that need medication, don't look happy and, always go lucky on TV. They have something else, that they need, and sometimes it's just getting to know your patient first before prescribing them anything is so important. Let's see. So the U.S. and New Zealand are the only two countries that allow pharmaceutical commercials, and I think this is really too many. In today's age, a lot of people look at TV as a selling point, and pharmaceuticals definitely are doing that. They're putting on puppies and happy people and butterflies, and of course everyone thinks that that's going to solve the world, but getting it to the meat and potatoes of really what the patient needs is so important before just prescribing the medication. But on the other hand, if I was using pharmaceuticals for a patient advantage, I think it'd be so beneficial for patients to have pharmaceutical commercials that talk about like what really happens when you take these meds. Not that they would do that because they probably wouldn't make any money, but I think more advertisements regarding proper nutrition and exercise would be better for Americans to see instead of these quick fixes, which is what pharmaceuticals are all about. I recommend exercise and a scheduled sleep pattern before prescribing Lunesta. If an individual really tuckers themselves out and eats right and exercises every day, they're going to be more tired and they're going to sleep better because their body is exhausted, their brain is tired, instead of just taking a pill to hope that it fixes everything. I'd recommend a sleep pattern that they go to sleep at a certain time each night, and kind of wake up at a certain time so their body kind of readjusts to that amount of sleep every day, instead of just giving them a pill. It's kind of crazy what a little exercise will do, but for some individuals that's all they need, and that will help them. So that's kind of Lunesta in a ballpark figure. I hope that you guys all do very well in pharmacology and in your future endeavors, and thanks for listening to me. Have a good one. Bye.